Hello everyone! Today, this video is part one of a three-part series about PCOS or polycystic ovarian syndrome, which is something I see quite frequently in practice. Either women are coming to me already diagnosed and looking for natural solutions, or they have absolutely no idea what's going on with their hormones. They're confused, they've been dealing with it for years, or they've been on birth control for years to help manage it, and I'm unfortunately the one diagnosing it later in life, which isn't always fun. 12 to 21% of women in the reproductive age actually have PCOS, but unfortunately 70% of these women are going undiagnosed. So there are a lot of you walking around out there with irregular periods or unwanted hair growth or having trouble losing weight, and you've gone to your doctor probably for some answers and you haven't gotten any, and no one's being diagnosed. So throughout the three video series, we're going to today talk about some signs and symptoms that you'll want to look out for. The next video will cover how to get diagnosed, what testing that I run with my patients to get them answers, and then some things you can actually start doing now to help balance your hormones, your blood sugar, and get your life back. When it comes to PCOS, so like I said, 70% of women are going undiagnosed, and a lot of this was because the diagnostic criteria previously was very, very strict, and a lot of changes have actually been made in the last few years that I'm happy about, because I think a lot more women are going to be diagnosed younger and diagnosed in the mainstream medical platform versus, having to find someone else and continuously seeking care to get some answers. So in order to actually be diagnosed with PCOS, you need to have two of the following three criteria met. So the first one is to either have anovulatory or legal ovulatory cycles, which this is just a fancy way of saying you're either not ovulating or you're ovulating maybe every other cycle or every third. You're kind of like willy-nilly ovulating throughout the year. And what this might actually look like is that you're having really long cycles. So you might be having like 40, 50, 60-day cycles, or you're not having a cycle at all. So, or you're not having any of the fertility signs, which we can talk more about in further videos. The second one is hyperandrogenism or high testosterone. And one of the great things about the changes that were made to the diagnostic criteria is that they will now accept either hyperandrogenism in lab work, or they will accept based for diagnosis if you are at least just showing the signs of high testosterone. So male pattern baldness, unwanted hair growth, like thick, dark, coarse hairs, things like that, even if it's not marked as elevated in the blood work. Now, I will talk more about the testing and what that should look like in the next video, but as a little snippet here for you, there's such a thing as optimal. So even if your testosterone or your androgens didn't come back marked as elevated in your lab work, that doesn't mean that they're not high or too high for you specifically. And then the third one is actually having visible cysts on your ovaries. So PCOS stands for polycystic ovarian syndrome, which essentially means you have multiple cysts on your ovaries. Now that you only need 2 out of the 3 diagnostic criteria, you do not have to have cysts on your ovaries in order to be diagnosed. And this is a huge change for women because not a lot of women with PCOS actually have cysts on their ovaries, or more than one cyst at a time. Cysts rupture and burst. You can go in 1 week and have 3 cysts and go in a couple weeks later and have none. So a lot of women were getting sent for ultrasounds if they were showing the signs and symptoms of PCOS, and their doctors were coming back and saying, you don't have any cysts, so that's not it. Here's the birth control pill. And now that you really don't have to have cysts on your ovaries, because PCOS is being more recognized as a metabolic disorder as well as an endocrine disorder, it's going to open up the road for a lot of women to get answers a lot sooner. Some women with PCOS do have cysts on their ovaries. In my practice, honestly, it's probably only 50%, and I don't check. I don't really care if you have cysts on your ovaries or not, unless they're causing you a lot of pain and discomfort or they're rupturing. But by working on the reasons why you have PCOS, the cysts will decrease naturally. So I don't send people for ultrasounds or ask them to ask their doctor for ultrasounds. It really doesn't change anything for me, but that might be one of the diagnostic criteria that you have out of the 3. So if you're someone who's been wondering what's been up with your hormones, if things feel a little bit wonky to you, if you've always kind of dealt with weird periods or changing periods or symptoms that just don't feel right, then these are some of the things that are related to PCOS that you might want to look out for. So we've already talked about irregular periods. So this is a really common one with PCOS. I do have a few women who have a fairly regular period. It's just a bit long, maybe above 40 days, but it comes fairly consistently every like 45 to 46 days. But that's not the case for everyone. Some women can not have a period for years on end and then just all of a sudden get one and then not have another. Some women might get it every 30 days and then the next cycle they get it in 40 and the next cycle they get it in 75, and it's just, there's no sort of pattern or rhyme or reason to it. It kind of comes and goes as it pleases. Any of these, or just no cycle at all, period, after you've had a period before, so you may have had one when you were younger and now it's gone and you haven't had it for years. All of these are signs that something might be up. Weight gain, especially around your abdomen, and not necessarily that you're continuously gaining weight year after year, but you've put on a little bit of extra weight and it's really hard to lose despite your best efforts. So you might be, exercising and eating really well, but the scale doesn't really change, and your clothes don't really fit any differently, and the fat deposits are actually difficult to lose. Hair growth in places that aren't consistent with women, so your mustache, your chin, around your nipples, around your belly button, those like dark coarse hairs that you have to pluck or shave. If that's something you've been dealing with, then it's definitely time to get you tested. Male pattern hair loss, so high testosterone makes us grow this like really sexy dude hair, but then it also makes us lose the beautiful hair we have on our head. So it's really just lovely, really lovely. Cystic acne is another one that comes along with high androgens or high testosterone. We typically get that acne along our jawline, on our chin, around our mouth, but it's those deep cystic lesions, especially if you're getting those as an adult. Acne can also come up on our chest, our shoulders, and our back, as this is the more male pattern consistency with acne. So those are things that we might want to look out for as well. And then greasy hair, skin, high testosterone, we produce more sebum, which also contributes to the acne, but then it leads us to have more greasy hair, greasy skin. So of this list, and there's a few more, we didn't get into like blood sugar regulation issues and things like that, but if you even have 2 of these, I would say it's definitely time to get some testing done, which we'll talk about in the next video. So come back next week. I'm going to post it here on IGTV. I'm also going to put it on my YouTube channel. You can find that at Dr. Kelsey Duncan, ND. And we'll talk about how to get you diagnosed. In the meantime, if you enjoyed this video or you know someone that would benefit from this video, please do share it with them. You can tag them in the comments or send it to them directly. And you can also navigate towards the Natural Choice Medical Clinic blog, where I have written about PCOS, the signs and symptoms, how to get diagnosed, and some proper treatment for you there. So www.naturalchoicemedicalclinic.com. It's in the health tips section if you click the tag for PCOS. The blog is also linked in my profile. If you click the live link, Linktree link down at the bottom, it'll say blogs, and if you click there, it'll go right to the health tips page, and you'll find lots of info there, not only about PCOS, but women's health in general, fertility, and pregnancy as well. So I will chat with you guys next week. If you have any questions before then, please don't hesitate to send me a message. Take care.